Vitamin D plays a critical role in maintaining various essential bodily functions. It is best known for its role in bone health, as it helps the body absorb calcium, a key mineral for strong bones and teeth. Additionally, vitamin D plays an important role in immune function, helping the body fight off infections, reduce inflammation, and support overall well-being. While the body can naturally produce vitamin D when exposed to sunlight, it can also be obtained through dietary sources like fatty fish, eggs, and fortified dairy products. For those who do not get enough vitamin D from sunlight or diet alone, supplements are a common and beneficial solution. However, what many people do not realize is that vitamin D can interact with certain medications, potentially leading to reduced drug effectiveness, increased side effects, or unexpected health risks. These interactions can alter how medications work in the body, making it crucial to understand the potential risks before taking vitamin D supplements, especially if you are on long-term medications. By learning about these interactions, you can take proactive steps to ensure that both your medications and vitamin D supplements are working safely and effectively together. Whether you're already taking vitamin D or considering adding it to your routine, it is essential to be informed about these risks. Welcome to Healthy Life Channel, where we explore vital topics to keep you well-informed and prioritize your well-being. Like this video if you're intrigued by natural health solutions. If you're new here, hit subscribe and enable notifications for our latest updates. Also, drop a comment below and let us know where you're watching from. We love connecting with our community. In this video, I'll explore 7 medications that should never be combined with vitamin D. I will explain why these interactions occur, how they affect your health, and what safer alternatives you can consider to prevent potential complications. 1. Cholesterol-lowering drugs, statins. How vitamin D affects their effectiveness. Cholesterol-lowering medications, particularly statins, are widely prescribed to help manage high cholesterol levels and reduce the risk of cardiovascular diseases. Some of the most commonly used statins include atorvastatin Lipitor, simvastatin Zocor, levastatin Mevacor. These medications work by inhibiting an enzyme, HMG-CoA reductase, in the liver, which is responsible for producing cholesterol. By blocking this enzyme, statins lower cholesterol levels, reducing the buildup of plaque in the arteries and lowering the risk of heart disease. Research suggests that vitamin D can interfere with the metabolic pathways that statins rely on. This happens because both statins and vitamin D are processed by the same liver enzymes, specifically the cytochrome P450 enzyme system, CYP3A4. When vitamin D and statins compete for these enzymes, it can alter the way statins are broken down, potentially leading to reduced effectiveness of statins, meaning cholesterol levels may not be adequately controlled. Increased side effects such as muscle pain, myopathy, fatigue, or liver-related complications. If you are on statins and take vitamin D supplements, do not adjust your dosage on your own. Instead, consult your doctor, who can monitor your cholesterol levels and adjust your medication or supplement intake as needed. 2. Diuretics, water pills. The hidden danger of calcium imbalance. Diuretics, also known as water pills, are commonly used to control high blood pressure, hypertension, reduce fluid retention, edema, caused by heart failure or kidney disease, manage conditions like liver cirrhosis. Types of diuretics that interact with vitamin D. Thiazide diuretics, e.g. hydrochlorothiazide chlorthalidone. Loop diuretics, e.g. furosemide bumetanide. Diuretics work by flushing excess water and electrolytes, like sodium and potassium, out of the body through urine. However, they can also affect calcium levels, which is where vitamin D becomes a concern. Thiazide diuretics reduce calcium excretion, meaning that more calcium stays in the bloodstream. If vitamin D levels are also high, this can increase calcium absorption even further, potentially leading to hypercalcemia, too much calcium in the blood. Loop diuretics, on the other hand, can cause calcium loss, increasing the risk of osteoporosis when combined with vitamin D deficiency. Potential risks of high calcium levels, hypercalcemia, nausea and vomiting, weakness and confusion, increased risk of kidney stones, impaired kidney function. If you are taking diuretics, your doctor may recommend periodic blood tests to monitor calcium levels. Also, spacing out your vitamin D intake and diuretics at different times of the day can help minimize interactions. These are just 2 of the 7 medications that can interact with vitamin D. Stay tuned as I cover the remaining 5 in this video, along with the safest ways to manage your supplements and medications for optimal health. Have you ever experienced unexpected side effects from taking supplements with medications? Let us know in the comments below. 3. Orlistat, also known as Xenical, and its impact on vitamin D absorption. Orlistat, commonly marketed under the brand name Xenical, is a widely used weight loss medication designed to assist individuals in managing their body weight by preventing the absorption of dietary fats in the intestines. It works by inhibiting the function of an enzyme called lipase, which is responsible for breaking down fats so they can be absorbed into the body. While this mechanism helps reduce calorie intake and supports weight loss efforts, it also introduces potential challenges, particularly in the absorption of essential nutrients, including fat-soluble vitamins like vitamin D. Vitamin D is classified as a fat-soluble vitamin, meaning it requires dietary fat to be effectively absorbed and utilized by the body. Along with other fat-soluble vitamins, A, E, and K, vitamin D is absorbed in the small intestine, where it dissolves in fats before being transported into the bloodstream. However, since Orlistat blocks the digestion and absorption of fats, it also unintentionally reduces the absorption of vitamin D, leading to a significant deficiency risk over time. Vitamin D plays a crucial role in multiple bodily functions, particularly bone health. It helps regulate calcium and phosphorus levels, which are essential for maintaining strong bones and teeth. A deficiency can lead to weakened bones, increasing the risk of osteopenia, osteoporosis, and fractures. Immune system support. Adequate vitamin D levels are necessary for a well-functioning immune response, helping the body fight infections and reduce inflammation. Low vitamin D can weaken immunity, making individuals more susceptible to illnesses. Muscle function and overall well-being. Vitamin D also supports muscle function, and its deficiency can lead to fatigue, muscle weakness, and an increased risk of falls. Managing vitamin D levels while taking Orlistat. To counteract the effects of Orlistat on vitamin D absorption, healthcare professionals strongly recommend vitamin D supplementation. However, timing is crucial. Taking vitamin D supplements at the same time as Orlistat is ineffective because the medication will continue blocking its absorption. Instead, vitamin D supplements should be taken at a different time of day, preferably with a meal that contains some dietary fat. This ensures optimal absorption and maintains adequate vitamin D levels in the body. For individuals using Orlistat long-term, regular monitoring of vitamin D levels through blood tests is advisable to prevent deficiencies and ensure that supplementation is effective. 4. Steroids and their effect on vitamin D metabolism. Steroid medications, also known as corticosteroids, are widely prescribed to manage inflammatory and autoimmune conditions such as rheumatoid arthritis, asthma and chronic obstructive pulmonary disease, COPD, lupus and other autoimmune disorders, allergic reactions, and skin conditions. While these medications are highly effective in reducing inflammation and suppressing immune system overactivity, they significantly impact vitamin D metabolism, leading to potential long-term health concerns. Steroids interfere with vitamin D in multiple ways. Reduced conversion to active vitamin D. The body converts vitamin D into its active form, calcitriol, through a process involving the liver and kidneys. However, steroids suppress this conversion, leading to lower active vitamin D levels in the bloodstream. Decreased calcium absorption. Vitamin D is essential for calcium absorption in the intestines, which is crucial for maintaining strong bones. When steroid use reduces vitamin D effectiveness, the body absorbs less calcium, leading to bone density loss over time. Increased calcium excretion. Steroids also promote calcium loss through urine, further contributing to bone weakening. Health risks associated with long-term steroid use and vitamin D deficiency. Increased risk of osteoporosis. The combination of reduced calcium absorption and increased calcium excretion makes individuals highly susceptible to osteoporosis and fractures, particularly in older adults. Weakened immune system. Vitamin D is crucial for a well-functioning immune response. Since steroids already suppress the immune system, their interference with vitamin D metabolism further weakens the body's ability to fight infections. People on long-term steroid therapy may require higher doses of vitamin D to compensate for reduced absorption and metabolism. Doctors may recommend bone density scans to assess the impact of steroids on bone health, especially for those on prolonged treatment. Increasing dietary intake of calcium-rich foods, such as dairy, leafy greens, and fortified foods, can help counteract calcium loss. Individuals taking steroids should consult their healthcare provider before adjusting their vitamin D intake, as personalized supplementation may be necessary. 5. Calcium channel blockers and their interaction with vitamin D. Calcium channel blockers, CCBs, are a class of heart medications used to treat high blood pressure, hypertension, irregular heart rhythms, arrhythmias, angina, chest pain caused by reduced blood flow to the heart. Commonly prescribed calcium channel blockers include amlodipine Norvasc, verapamil diltiazem. These medications work by relaxing blood vessels and reducing heart rate, thereby improving blood circulation and lowering blood pressure. However, their interaction with vitamin D can create potential complications. Vitamin D plays a key role in calcium regulation in the body. It enhances calcium absorption from food, which increases calcium levels in the bloodstream. When combined with calcium channel blockers, this effect can interfere with the medication's ability to control blood pressure and heart function properly. Potential risks of combining vitamin D with calcium channel blockers. 1. Elevated blood calcium levels. Hypercalcemia. Since vitamin D increases calcium absorption, excessive intake may lead to high calcium levels, which can interfere with blood pressure regulation, making it more difficult to control hypertension. Exacerbate common side effects of calcium channel blockers, such as dizziness, swelling in the legs, and irregular heartbeats. 2. Unpredictable blood pressure fluctuations. In some cases, the combination of vitamin D and calcium channel blockers may reduce the medication's effectiveness, leading to less controlled blood pressure. Individuals taking both vitamin D and calcium channel blockers should have their calcium levels regularly checked to prevent excess calcium buildup. If calcium levels are elevated, doctors may recommend lowering the vitamin D dosage or spacing out supplementation. Since the interaction varies by individual, it's important to speak with a doctor before making any changes to vitamin D intake while on heart medications. 6. Seizure medications. The hidden impact on vitamin D absorption. Seizure medications, commonly referred to as anticonvulsants, are essential for managing neurological conditions such as epilepsy and other seizure disorders. While these medications effectively help control abnormal brain activity and prevent seizures, they can also interfere with the body's ability to maintain adequate vitamin D levels. Certain antiepileptic drugs, AEDs, including phenytoin, phenobarbital, carbamazepine, and primidone, are known to accelerate vitamin D metabolism in the liver. These medications stimulate liver enzymes, particularly those involved in the cytochrome P450 enzyme system, which leads to the increased breakdown and clearance of vitamin D from the bloodstream. As a result, individuals taking seizure medications over an extended period may experience chronically low vitamin D levels, putting them at a significantly higher risk for bone-related health issues. This is particularly concerning because vitamin D plays a critical role in calcium absorption, which is essential for maintaining strong and healthy bones. When vitamin D levels are insufficient, the body cannot properly absorb calcium, leading to weakened bones, reduced bone mineral density, and an increased risk of fractures, a condition known as anticonvulsant-induced bone disease. Beyond bone health, a deficiency in vitamin D can also impact muscle function, immune response, and overall well-being. Studies suggest that individuals with low vitamin D levels may experience muscle weakness, increased susceptibility to infections, and even mood disturbances, including symptoms of depression and fatigue. For individuals on long-term anticonvulsant therapy, regular monitoring of vitamin D levels through blood tests is essential. This allows healthcare providers to assess the extent of vitamin D depletion and recommend appropriate supplementation if needed. To counteract the enhanced metabolism of vitamin D, doctors often advise vitamin D supplementation, taking higher doses of vitamin D, as recommended by a healthcare professional, can help maintain adequate levels. In some cases, prescription-strength vitamin D, e.g. calcitriol, the active form of vitamin D, may be necessary. A diet rich in vitamin D. Consuming foods high in vitamin D, such as fatty fish, salmon, mackerel, sardines, fortified dairy products, egg yolks, and fortified cereals can help support vitamin D levels naturally. Sunlight exposure. Spending time in natural sunlight allows the body to produce vitamin D through skin exposure to UVB rays. However, individuals should be mindful of sun safety to avoid skin damage. Calcium intake. Since vitamin D is essential for calcium absorption, individuals on seizure medications should also ensure they're getting enough calcium from dietary sources, such as leafy greens, dairy products, and fortified plant-based milks. By being proactive about vitamin D intake, individuals taking seizure medications can help reduce their risk of bone loss, fractures, and other health complications while still effectively managing their seizures. 7. Laxatives. How long-term use can deplete vitamin D and affect nutrient absorption. Laxatives are commonly used to relieve constipation and promote regular bowel movements, but their frequent or long-term use can interfere with the body's ability to absorb essential nutrients, including vitamin D. The main concern arises from the way laxatives accelerate food movement through the digestive tract. When food passes too quickly through the intestines, there is less time for nutrients to be properly absorbed. This can lead to malabsorption issues, particularly for fat-soluble vitamins like vitamins A, D, E, and K, which require adequate digestion and fat absorption to be utilized by the body. The impact of different types of laxatives on vitamin D absorption. Osmotic laxatives, e.g. magnesium citrate, polyethylene glycol, draw water into the intestines to soften stool. Overuse can lead to electrolyte imbalances, dehydration, and reduced absorption of nutrients, including vitamin D. Stimulant laxatives, e.g. senna bisacodyl, work by stimulating intestinal contractions, speeding up bowel movements. Long-term use can cause dependency, meaning the intestines rely on laxatives to function normally, further disrupting nutrient absorption. Bulk-forming laxatives, e.g. psyllium husk methylcellulose, are considered the safest option because they add fiber and bulk to stool, mimicking natural digestion. However, insufficient water intake while using these laxatives can lead to incomplete digestion and impaired vitamin absorption. Long-term consequences of vitamin D deficiency from laxative use. If laxatives are used excessively, individuals may develop chronic vitamin D deficiency, which can lead to weakened bones and increased fracture risk. Since vitamin D is essential for calcium absorption, deficiencies can lead to osteoporosis or osteomalacia, soft bones, over time. Compromised immune function. Vitamin D plays a role in modulating immune responses, and insufficient levels can result in increased susceptibility to infections and inflammation. Muscle weakness and fatigue. Low vitamin D can contribute to muscle cramps, overall weakness, and fatigue, which may impact daily activities. Electrolyte imbalances. Excessive laxative use can disrupt potassium, magnesium, and sodium levels, further affecting nerve function and muscle contractions. To minimize the impact of laxatives on vitamin D absorption, consider the following strategies. Use laxatives sparingly. If laxatives are needed, they should be used for short-term relief rather than a long-term solution. If constipation is persistent, consult a healthcare provider to identify underlying causes. Adopt a fiber-rich diet. Increasing intake of fruits, vegetables, whole grains, and legumes can help maintain natural bowel regularity without the need for laxatives. Stay hydrated. Drinking plenty of water supports healthy digestion and optimal nutrient absorption, reducing the need for laxatives. Time vitamin D supplementation appropriately. If you're using laxatives regularly, it's best to take vitamin D supplements separately from laxative use to maximize absorption. Taking them with a meal that contains healthy fats, such as avocados, nuts, or olive oil, can further enhance vitamin D uptake. By being mindful of how and when laxatives are used, individuals can avoid nutrient deficiencies and maintain better overall health, ensuring that vitamin D levels remain sufficient for bone, immune, and muscle health. Vitamin D is essential for bone strength, immune support, and overall well-being, but its effectiveness can be compromised when combined with certain medications. From seizure medications accelerating vitamin D breakdown to laxatives reducing its absorption, These interactions can have serious health consequences if not properly managed. To ensure adequate vitamin D levels, individuals should monitor vitamin D status through blood tests, follow a nutrient-rich diet, consider appropriate supplementation under medical supervision, discuss potential medication interactions with a healthcare provider. By staying informed and proactive, you can protect your health, prevent deficiencies, and maximize the benefits of vitamin D while managing your medical needs. If you found this information helpful, give this video a thumbs up, subscribe for more health insights, and let me know in the comments if you have any questions. Stay informed and take care of your health.